You're listening to the ADHD Heroes Podcast, a podcast where we speak with the heroes of the ADHD community, namely educators, mental health professionals, and of course, those with ADHD themselves, to gain insights, tools, and most importantly, inspiration towards succeeding and thriving with ADHD. I'm your host, Rabbi Shmuel Reich, a high school Rebbe and an ADHD coach in private practice. Welcome to the show. Hi there. On this week's episode, I spoke with a psychiatrist named Dr. Naghdechi. We discussed the basic questions that tend to arise around the use of ADHD medications, such as what the different medication options are, what benefits medication can provide, what limits they have, different concerns people have about them, and a lot more. This episode only discussed the very basic questions, and in the future, I hope to have more episodes in which specific issues and questions about ADHD medications are addressed. Dr. Lancer and I have actually already recorded another episode together with his business partner, Yafa Gordon. So if you have questions about ADHD medications you'd like to hear addressed on the show, you can, as always, reach out to me at adhdheroespodcast@gmail.com. Before we dive into the episode, I'd like to tell you about another podcast I listen to called the Naghdechi podcast. The host of the Naghdechi podcast is former ADHD Heroes podcast guest, Rabbi Yerachmiel Garfield, Menahel of Yeshiva Torah's Emes of Houston, Texas. Rabbi Garfield interviews a wide range of creative thinkers who are already implementing their valuable innovations in the world of education, such as a unique anti-bullying program, an outdoor leadership training program, and a science curriculum that highlights seeing the hand of God in science. So whether you're a principal looking for new ideas to implement broadly, a classroom educator looking for inspiration, or a caring parent looking for hope through what is coming down the pipeline, the Naghdechi podcast may be for you. Also, Rabbi Garfield has recently come out with a new book called When They Were Young, with inspiring stories from the younger years of great rabbinic giants and what we can learn from them. If you'd like an ad for your product here on the ADHD Heroes podcast, you can send us an email at adhdheroespodcast@gmail.com. Now on to the episode. Enjoy. Dr. Lancer Naghdechi, welcome to ADHD Heroes podcast. I'm excited for our conversation today.
Likewise. Thanks for having me.
Okay, pleasure. So first, a little bit about yourself and your background.
All right. So I was born in South Florida. I'm from Los Angeles. I did some training in LA. I did some training in Chicago. I did some training in New York and New Jersey. So I've been around. I'm a double board certified child and adult psychiatrist. I have some training in psychotherapy as well. I'm licensed in New York, New Jersey, and Florida. I have a concierge style practice. I do home visits, and I treat everyone and everything.
Sounds like a busy day. How'd you get into that?
Well, my parents are Jewish. They always told me to be a doctor. I told them I don't want to be a doctor. I want to be a psychologist. I studied psychology at UCLA in undergrad. And then I decided I wanted to be a psychiatrist. I learned more about the field, and I went to medical school to be a psychiatrist.
Excellent. So I hope they're really happy about it.
Sometimes I still get, you should have been a surgeon, but I tell them you need me more than a surgeon.
Oh, gosh. Okay. All right. So let's dive right into things. Today's topic is going to be ADHD medications. So let's do it. For whom is ADHD medication potentially recommended?
For anyone meeting the diagnostic criteria for ADHD, and that could be kids, it could be adolescents, it could be adults. Essentially, they have to meet the criteria. It's a series of symptoms, including hyperactivity or impulsivity or inattention. Most of them have to be present at a young age. You have to have a good understanding of the individual to rule out any other sources of these symptoms. But as long as everything else is okay, then anyone that meets criteria for ADHD would benefit from ADHD medicine.
Got it. Which symptoms specifically does the medication help with?
There's a subset of people with ADHD that have the inattentive subtype. So these are people who forget things or misplace things, and then there's the subtype of hyperactivity. So these are the people that are they can't sit still, they're fidgeting. And it looks different for children versus adults. For children, it might be the child that I'll use myself as an example. Everyone else in my class had their binders very neatly organized, but I had a backpack with papers crunched in the bottom of it. And for adults, this could mean missing doctor's appointments or quitting jobs. The hyperactivity part could manifest as speeding tickets, or as I mentioned, missing appointments. So it really could vary.
Right. So where will what will the medication help with? Meaning the meds help with attention. They help with hyperactivity. Are there ADHD type behaviors that the medication does not address?
So let's talk about the different kinds of medicines. There's, the gold standard are the stimulants. These are things like Adderall or Vyvanse or Ritalin. These help with both. They help with the inattentive symptoms and also with the hyperactive symptoms. They help overall with executive functioning. And then we have, a separate class of medicine, non-stimulants, and within that class there are subclasses. And so, for example, we have the alpha agonist class of medications like Intuniv or Clonidine. Those tend to help more with the hyperactive symptoms than the inattentive symptoms, although there is some overlap. So when choosing a medicine, it really, it's difficult to say that this medicine is good for this symptom and that medicine is good for that symptom. Especially in my practice, I like to see the big picture. I like to see the person as a whole, and try and find something that helps them not only with their ADHD but with any underlying disorder they might have.
I guess what I'm wondering is, in my side of things, they say there's an expression. They say the pill can't teach skill. You know that one?
Can't teach skill.
The pill can't teach skill. So I have people come in, they're on medication, so now we can teach them skills, but the medication doesn't help them. The other way they say it is the medication won't pack your knapsack for you.
Of course.
So
Yes.
where does the medication what does the medication do, and where does it stop?
So, okay, so let's say you have a child that is more on the hyperactive side. So, they're disruptive in class, they're disruptive at home, the family feels like they're under attack, right? And so this child probably needs some kind of behavioral modification. But, you know, in order for that to sink in, he needs the medicine to kind of be able to absorb all of that stuff. So in that scenario, the medicine kind of allows for the therapy and everything else to kick in. But the same thing goes for someone that's inattentive. I mean, if you can't sit through a therapy session with a therapist as an adult, right? Then taking a stimulant that could help you with that would very simply allow the therapy to happen.
Right. So if I'm understanding correctly, you're saying that the medication will help them, I guess, focus enough, sit still enough, and be receptive enough to then learning either new skills or the therapy process, digging up what they need to dig up, processing what they need to process. So it sounds like the medication helps them almost function as a seatbelt to get them in a good place to be able to be receptive, and then they can learn what they need to learn. Is that right?
Basically, yeah, in very basic terms, yes. You need to be able to focus. You need to be able to sit still in order to learn something new. But some people don't need the second part. So for some people, once they take the medicine, they're okay with that. They can function with the medicine, and they're happy with that. They're not interested in the therapy aspect. They're not interested in doing things. And some people use it daily. They need it to function in their role as a mother or in their jobs. Some people use it as needed. If someone has an exam coming up and they really need to hunker down. For some children, it's they take it when they're in school and they're in class, but not when they're in camp. So it really varies.
All right. So if I'm understanding correctly, you're saying that it varies based on what the needs are. So if their skills are not that impaired, it's just the attention, the focus, or the ability to sit, So then the medication will help on its own.
Yeah, in some instances, the medication will help on its own. In some instances, the medication will help with learning how to do things in a less in a more organized way. In some cases, it's just a tool, and in some cases, it's I like to use the example of reading glasses. Some people need reading glasses all the time. Some people just need reading glasses to read, right?
Right. Right. So really, people should take it as needed. People are taking it as needed. So some people will need it every day, and some people will not. Am I getting that correctly?
Some people will need it every day. Some people will not. Some people will use it and learn new skills and grow out of it, and some people will you know will use it continually as needed. It really, again, it's I don't like using these blanket statements. It's really an individual process, according to what's best for the individual.
Right. Got it. So you're saying it really depends on what their specific needs are, and
Yeah.
it can really vary. Got it.
Hmm.
Okay. Is there an age that is too early to start taking it, and is there an age that's too late to start taking it?
Yeah. So the recommendation for kids under 6 is to start with behavioral therapy initially. We do use medication in kids younger than 6 if the symptoms are severe or the behavioral interventions are not working. In terms of an upper limit, I'd say the limiting factor with an upper limit would be if there's any health concerns or interactions with any of the other medicines. But I have seen older people take the ADHD medications as well.
Got it. Okay. Okay. Do different. You mentioned the different medications before. I guess we could take a little bit of a closer look at that. What do the different medications do with regard to how you decide a particular individual, for a particular individual, which medication to recommend?
So again, there's two main classes of ADHD medicines. They're the stimulants and then non-stimulants. So for stimulants, there are two main ones. There's the amphetamine based ones, and those are like Adderall or Vyvanse, and then there's the methylphenidate based ones, and those are like Ritalin or Focalin or Concerta. These medicines tend to work right away. They don't take time to work. We see the effects, within a few days. The differences between all the different ones basically comes down to when they start working, how long they work for. Again, these are what we call adrenergic stimulants, so they kind of come with their own set of side effects. So when we decide who to put what on, we have to see what other medical and psychological comorbidities there might be. And so for some people, those might not be the best choice to start out with. And so we look at the non-stimulant medications. So the non-stimulant medications, there are a class of them that work kind of similarly to antidepressants, and these are things like Wellbutrin, there is Strattera, there is Qelbree. These take a little bit longer to kick in, and they are not as they don't work as well as the stimulants. They don't work as fast as the stimulants, but they work. And then I'd say the subcategory are the alpha agonists. So these are things like guanfacine or clonidine. The brand names are Intunev or Capve. These work more by reducing what we call the sympathetic tone or fight or flight response. And so they are good for people with hyperactivity. They are good for people with co-occurring anxiety. Versus the stimulants kind of work in an opposite fashion. They activate the sympathetic nervous system, the fight or flight response. So they sharpen your attention, but they might lead to more anxiety. And so, again, I come back to it. It comes to seeing the person as a whole, and making sure that you're not missing any other kind of symptom or diagnosis when you're treating any ADHD symptom.
Got it. So if I'm understanding correctly, it sounds like first option is going to be the stimulants, but they're not going to work for everybody.
In many cases, the
Yeah,
first option is the stimulants. For some people, it's not the best first choice.
right.
Yeah.
Got it. And which ones? I guess is the guanfacine commonly used for emotional dysregulation? Are you putting that together with anxiety and emotional dysregulation in our team?
All of these work for emotional dysregularity, I would say. But if someone has OCD or severe anxiety, I would shy away from using the stimulants first line.
Oh, interesting. Okay.
I would also add to that list any co-occurring substance use. I wouldn't start with a stimulant in someone who has a substance use disorder.
Oh, interesting. Because it's a controlled substance.
Because it's a controlled substance, because and it's not something that we really worry about the addiction piece of it, but in someone who has a history of addiction, then it's kind of on our radar.
Got it. What's the concern?
Well, at high doses, the stimulants can be addictive, but at the doses that we're prescribing, it's not really a concern. However, if we have someone that we are concerned about selling the medication or hoarding the medication, or taking more than they're supposed to, then that's something that we would be concerned about.
Got it. Do you see a lot of people becoming addicted to it? I have not. I had someone on. We had someone on the show who deals with addictions, and he has seen a lot of it. What's your experience been?
I have seen people addicted to it. Usually, in terms of the addiction to the stimulants, we everyone has heard about methamphetamine, right? So we prescribe amphetamine and amphetamine based things. Methamphetamine is also amphetamine based. However, it's slightly different. It has a carbon group. It makes it a lot, as we say, stickier to the receptors. It's a lot more potent. So in that vein, when someone takes a higher dose of these prescribed medications and they do that over a long time, then yes, we can see both physical and psychological dependence.
So it might have to do with the amount of time they're taking it for. Did I get that right? And the dose?
The dose, yeah. So that's why you have to get your medicine from a doctor and
Right.
make
Okay.
sure the doctor is making sure what you're taking.
Got it. Okay. What does the process tend to look like? Meaning the process of beginning to take medication and identifying side effects, identifying whether the dose is the right dose for the individual. What does that process tend to look like?
Okay, well, I mean, I think it varies based on the person and the presenting symptoms. But let's say I get a 20-year-old that's having trouble in school because he can't pay attention, right? And he has no underlying medical conditions, or psychological conditions. Stimulant would be my first choice. I would start him on the stimulant on a low dose. We would take a baseline blood pressure if we don't have one already, and we'd see how he does. And I'll tell him, let me know how it goes, and either he'll tell me, hey, I feel great on this, it's a lot better, I like this, or he'll say, I really don't like how I feel on this, or he'll say, I feel a little bit better, but I don't know yet. So based on that, we'll either change the medicine or change the dose.
Right. What tend to be the complaints that they have? Meaning, if they don't like how it's making them feel, what are the feelings they're having that they're not liking?
Mm-hmm. Good question. So, one big class of the population that may have a different reaction to these medicines, the neurodiverse population. So, people with autism, for example, they may not respond typically to these medicines. They might have an opposite reaction. It might make them worse, make them more behavioral, more hyperactive. Another common complaint is, and this is mainly because the dosage or the type of the medicine. They feel like they can focus, but they feel too focused. They feel hyper focused, or they feel awkward, or they feel weird. So I've seen that as well, and that tends to go away with the dose adjustment or medication adjustment.
Got it. Where do issues of appetite or suppressed affect come into play?
Right. So with the stimulants and also some of the non-stimulants, there does come this side effect of suppressed appetite. It depends on who the patient is and what's going on, but mostly I tell my patients take the medicine first thing in the morning, and then make sure you're having a good breakfast so that by the time that you eat your breakfast, it's in your system before the medicine is doing its job. And of course, we monitor the weight. We speak with the primary care doctors, whoever else is involved, and make sure everything is going well. There are some cases in children who have severe symptoms and who nothing else works, no other medicine has worked for them, and so in those particular cases, we may add something to increase the appetite.
Oh, interesting. To balance that out, meaning they need this medication, but but the
Right.
side effect needs to be addressed.
With regards to the emotional blunting you mentioned, yeah, that comes down to a dosage adjustment or reevaluation to make sure there's no underlying other no other underlying conditions. If there's maybe a depression or something else going on.
Got it. Is this process different in kids? Because I imagine like a 20-year-old can come in and tell you, "Hey, I'm feeling this way, I'm feeling that way." They'll be a little more responsive. With kids, they sometimes have different ways of communicating. We'll say,
Yeah, so kids are a lot different. For kids, mostly we obviously we see the child, but we also speak with the parents, we speak with the teachers, we speak with the therapist, the OT, the speech therapist, whoever else is involved. We try to get feedback from wherever we can.
got it. Meaning the kid themselves isn't always able to communicate the same way. So the adults in their life will pitch in.
Hmm.
Got it. For kids, are there adjustments along the way as they grow?
Yeah, definitely. A lot of kids, they start off with one type of stimulant, and as they get older, they switch to another type, or they'll start with a non-stimulant and they'll switch to a stimulant, or as kids go through puberty, other mental health issues arise, and so the focus may shift from this is just ADHD to maybe this is a mood disorder coming up, or something else.
Interesting. So does it have to be monitored more closely?
Yeah.
Right. Okay. Next, what concerns do people have before starting the whole process? Like the concerns that need to be allayed. Yeah.
Yeah, great question. I get this all the time, especially from parents. So, the addiction piece is one which I tell them, it's really, as long as you follow the directions and you're not taking doses that I'm not prescribing, it's not something I'm worried about. And then there's obviously the stigma. Is this a crutch? Is this, are we giving the child the easy way out? Are they going to be dependent on this? Are they going to be reliant on this? So, again, I like to use this example of reading glasses, and I tell parents, if your child needed reading glasses, would you have the same response? The kid needs glasses to read the board, to learn what he has to learn, to succeed, academically, socially. And if this medication can improve his trajectory throughout his life, why wouldn't you?
All right. What tend to be the responses you get to that?
Um, you know, with time, I find that a lot of parents and a lot of patients, they tell me, you're the first person that actually took their time to talk to me. So once these concerns are addressed with parents and they feel comfortable and they trust you, then you allow them to try the medicine, and the medicine works, and then they realize what's been going on, and they get on board pretty quickly.
Interesting. So you're saying even just hearing them out, allowing them to be heard instead of dismissing their concerns, that itself can help them, be more comfortable with the process.
Yes, of course.
What are concerns that are legitimate but can be addressed? Are there concerns like that?
Yes, of course. So if in anyone that has a personal or a family history of heart disease, before starting them on a stimulant, we want to get an EKG. We want to make sure everything's okay. Obviously, we do a thorough evaluation and history. We get family history. and psychiatric history. We make sure there's no underlying bipolar disorder, no underlying psychosis, no underlying OCD or anxiety. Unfortunately, nowadays, people talk about symptoms as if they're disorders. So, I talk to a lot of people, and they, inattention and ADHD are almost used interchangeably. But inattention is a symptom of almost any diagnosis in the
That's true.
DSM, right? Let
Yeah.
alone in all of medicine, right? If you have a sore throat, it's kind of hard to pay attention.
Yes, it is.
So, you want to make sure you are doing a thorough evaluation and you are getting a good history and you are coming to the right diagnosis. And to add to that, I tell all my patients, these diagnoses don't define you. In our field, everything's subjective, and so we don't really. I say I don't like to treat a diagnosis. I like to treat a person.
Well, very good. So I guess if I'm understanding correctly, you're saying that even if they have, a predisposition for certain behaviors, if life is adjusted in a certain way, that those don't become a problem, which can work out pretty well with ADHD in particular. They become a firefighter or an emergency doctor or something. So
Mhm.
they the need for adventure can be addressed in that sort of way. Um, they can need a lot less intervention if life is adjusted to suit their brain type. Am I understanding correctly?
Yes, I mean, I'm of the opinion that the body has the means to correct itself if given the right things, and if everything falls in the right place. And so medication is just one piece, but like you said, if everything goes as planned and everything's working for the person, then they can succeed.
Have you seen, you mentioned before, people who no longer need the medication? Do you see that a lot?
Do I see it a lot? I mean, it's hard to say because you don't know who's walking around with a history of ADHD and who's not. I do see a lot of people that say they were diagnosed with ADHD in the past, and if those people are coming to me as adults, most of the time the main issue may not be the ADHD, but they do have some impairment in their life, in their work, in their relationships, which could be tied to the ADHD. So, you know, I see the ones that have recurrent adult ADHD with impairment, but the ones without impairment may be walking around not coming to see me.
Oh, got it. So you're saying you think it's common, but they're not coming to you. They don't need a psychiatrist.
Yeah, I mean,
Right,
if you have
got it.
ADHD and it's working for you as an adult and you don't need treatment, there's no reason to talk to me.
Right. If it ain't broke, don't fix it.
Hmm.
Okay, what are concerns that people have that are either not founded or based on truths but exaggerated?
Okay, great question again. So, like we said, the addiction piece, I think, again, if you're getting it prescribed by a doctor that with the caveat that it's a good doctor and knows what they're doing and cares, the addiction piece is not really a concern unless there's suspicion that the patient is hoarding the medication or selling it or whatever. For children, there is this concern of growth retardation. Earlier research suggested there may be a stunt in growth when put on stimulants, but newer research has shown that those kids eventually catch up. So the growth stunting is not really a concern anymore. Um, there used to be a lot bigger concern of cardiac issues. Now it's standard practice to get the EKG only if there's a history or a family history.
Is there anyone else for whom ADHD medication is not recommended or not necessary even when they have ADHD?
Certainly, if they don't have ADHD, then whether they need the ADHD medicine is it varies person to person. People use ADHD medicine for other things as well. And if you have an allergy to the medication, it's one thing. If you have, like I said, if you have an underlying OCD or psychotic disorder or bipolar disorder, that's something that you'd have to reevaluate as well. I think as long as medically and psychiatrically things are okay, then I don't see a reason, not to start the medicine. Again, substance use is another thing that we think about sometimes. Another thing that I think, is an exaggeration. I don't like to use the word exaggeration, but I think that people are a little bit too worried about is this black box warning that comes with the ADHD medicines about causing suicidal thoughts or behaviors in young people. Um, when we look at the studies that these come from, there were actually no increased suicides. And when this warning came out, people stopped prescribing these kinds of medicines, and suicides actually increased. So, if you ask any child psychiatrist, they're going to tell you they have a big beef with this black box warning of increased suicidal thoughts or behaviors in the antidepressants and the stimulants. So I would tell parents that it's not a huge concern of ours, even though we do monitor it and make sure everything's okay.
Oh, where did that come from? I mean, it sounds like it's not such a concern. So where do they think it came from?
Well, it came from the earlier studies from the antidepressants in children. They suggested that there was an increase in suicidal thoughts and behaviors, although they didn't really define what those behaviors meant, but there were no increase in suicides. So it's been kind of a back and forth with the regulatory agencies about, does this really have to be there?
All right, so there was an increase in thoughts, but not actions. That's what happened.
Something along those lines, yes.
Okay, what is a message of hope you want to leave our listeners with today?
Message of hope is, you can get help. You can do a lot better. If you're running a business, your business can improve. If your family, your relationship needs help, this can help with that. In school, academically, this can help with that. Socially, this can help with that. So, message of hope is you can get help. It's just a matter of asking for it.
Excellent. Okay, so speaking of asking for it, how can people get in touch with you?
My cell phone number is 646-363-6303. I give all my patients my cell phone number. I make myself available. I do home visits. I do Zoom visits. I'm licensed in New York, New Jersey, and Florida. Um, I try to make it easy for people.
Awesome. Okay, so we'll put that in the show notes. Excellent. Thank you, Dr. Lancer Naghdechi. This has been great.
Thanks for having me.
Thank you again for listening to this episode of the ADHD Heroes podcast. For questions about the podcast, you can email us at adhdheroespodcast@gmail.com. Also, for sponsorships or to share your story, your ADHD story, you can also email us at the same place, adhdheroespodcast@gmail.com. To be in touch with me about ADHD coaching, writing, or speaking engagements, you can email me at rsreichadhdcoach@gmail.com. Be sure to check out my website, rsreich.com, adhdcoach.com. You can follow me on LinkedIn, or you can check out my blog on nefesh.org. Check out my blog there under my name. Important disclaimer: podcasts are great, but they do not take the place of mental health help or medical help. So if you need help with mental health or need a doctor, be sure to be in contact with some of them. Please, if you like this show, please rate, review, and share with a friend. That's how these things get out there. Thank you again for listening, and thank you to our producers at Pretty Easy Podcasts.